I'm here with Dr. Angelo Lazaris, one of the top cosmetic dentists in Sydney, and I want to talk to Angelo about the new integration of digital dentistry, smile design, the ability for a general dentist to now plan their case before they start their veneers. So thanks so much for taking the time. We are at a seminar today, and Angelo's just opened the seminar with a great lecture. I was amazed at the workflow. Do you want to tell us a little bit about your pathway and how you got to be where you are today?
I think what it boils down to is having a vision in mind where you want to end up, and that's a consistency both in terms of your career, but even the way that you approach every case. The ability to visualise or pre-visualise the end result before you start anything is key, and I think that's where the innovation of these digital technologies really stands on its own. And it's simplified the workload from being able to diagnose a presenting issue and being able to differentiate the etiology, whether it's a restorative issue, whether it's an orthodontic or an orthodontic issue. These are all things you need to work out before you get down that path of the patient.
I've always seen cases where patients classically div 2 and someone's hopped in straight with restorations and almost gone to the pulp of the laterals. I mean, what would you suggest is a simple way for someone to learn how to do some movement without having to sort of learn the full orthodontic process?
The only orthodontic treatment that I actually ever do is pre-restorative. And again, this boils down to understanding both the principles of smile design and the materials that you're dealing with. When we're looking at the tooth structure and the success rates of restorations like claws and veneers, they're highly dependent on the substrate. Preserving enamel is key, and the only way that you can do that is keep a consistent thickness of your ceramic and to keep the tooth healthy to not cause the DEJ when you're doing your preparation. As soon as you do that, all bets are off. Right. In terms of longevity of restoration, the health of the pulp of the tooth in the long term. So learning to position the teeth in a way where you're not over prepping is the first stage of any aesthetic rehabilitation.
And I think the other thing I've seen people do a reasonably good job, but then you see the gingival margins don't even marry up amongst the 60. Any tips on that? Especially
with adult cases, it's always a combination of crowding or malpositioning of teeth and wear. You always get the two hand in hand. So when we're aligning teeth to worn incisal edges, we're inevitably going to get the gingival profiles and margins misaligned. The thing is to be able to pre-visualize what the restored tooth would look like. That means aligning gingival margins and actual inclinations of teeth and ignoring the incisal edges. This is something that gets built up later.
The ability to put mock-ups in the mouth so the patient can visualize what they're signing up for. How do you do that if you have malaligned teeth with gingival margins that are everywhere?
Well, the simple answer is that you can't do that. What you've got to present to a patient as a mock-up is a realistic expectation of the end results. And whilst the teeth are malpositioned, you're never going to be able to achieve that. Apart from the medico-legal implications of informed consent, what you're presenting to a patient is really what they're investing in and what the expected outcome is going to be. You can't possibly project that with the teeth in the wrong position. So I don't even go near a mock-up unless the teeth are in the right positions first. And that's how you get to let the patient understand the importance of that.
Thanks again for your time.
Thank you.
And fantastic lecture.